Is it normal to suffer with heavy periods? Well, obviously all women have periods from their menarche, i.e. the start of periods, until their menopause, i.e. the end of periods. A proportion, and it's probably about 1 in 3 women, will actually suffer with heavy periods during that time frame. Heavy periods usually become more of a problem in your 30s and 40s, but they can affect people at any stage during their menstrual life. It's not normal to have heavy periods. However, it is quite common to have heavy periods. Women typically suffer from heavy periods. About 1 in 3 women will suffer with heavy periods at some stage in their lives. And this can be treated with a range of different treatments, from hormonal treatments to surgical treatments, depending on the underlying cause. Effectively, periods are caused by hormonal control of the lining of the womb, or the endometrium. And there's a balance of hormones from the ovaries, which are estrogen and progesterone. And it's that balance of hormones which normally controls the heaviness, the frequency, and the regularity of periods. If there is hormonal imbalance, that is the most common cause for heavy periods or period problems. And this is called dysfunctional uterine bleeding. And it implies that there is no anatomical or physical cause for the abnormal bleeding. It's purely hormonal. However, about half of women will have an anatomical cause for their bleeding problems. And so that may be things like endometrial polyps, where there is a little skin tag inside the uterus or on the cervix, or they'll suffer with fibroids, which are benign thickenings on the muscle wall of the uterus. And fibroids make the uterus bigger, but also they increase the lining of the womb, which therefore has more bleeding each month. So things like polyps and fibroids, but also other conditions such as endometriosis, can cause problems with heavy periods. There are other causes which are less frequent, but we always look for anatomical causes of heavy periods in women who haven't responded to initial hormonal treatments, or women where examination findings are abnormal. The main risk factors for heavy periods are, unfortunately, being a woman in your 30s or 40s. There are familial, that means not inherited, but conditions which may run in families, such as fibroids, which are more common in certain families, and also genetic predisposition, but also conditions like endometriosis, which we know are not genetic. However, they do tend to run in families. And so if there are genetic predispositions to people having heavy periods, fibroids, endometriosis, then yes, you are more likely. Heavy regular periods are rarely a sign of underlying cancer. However, anybody with irregular or erratic periods, particularly beyond the age of 45, we always want to check for or look for abnormal cells or cancerous cells. Heavy periods in themselves are far more likely to be due to benign conditions such as polyps, fibroids, endometriosis, or just underlying hormonal problems. However, if periods are frequent, if they're happening all the time, if they're prolonged bleeding, if there's lots of bleeding between periods or bleeding after intercourse, then that needs to be checked out more thoroughly, more quickly, to look for any abnormal cells which might affect the cervix or the lining of the womb. And so heavy regular periods, not usually a concern, but it's the frequency or irregularity of bleeding which will be more of a concern.